Hey, this is Doug Fielder along with Ron Bachman, and welcome back to segment of Healthcare Consumers and Radio. It's been a show of transparency today, talking about transparency.
It's an important area. Of course, I've always said I really don't even like the term transparency. It's one of the most important areas, but I really prefer the concept of the right to know. Yeah. People can claim transparency is proprietary. They don't have to disclose it, but when you turn around and say, a patient has got a right to know this stuff. A patient has a right to know about quality and about prices and access to care. So I think this is a very important show, and these are very important organizations that are really trying to open up this whole area of transparency. And I understand we got the next one coming up right now.
We do, and joining us today is the president of Consumers Medical Resource, David Hines. David, good morning.
Good morning. How you guys doing today?
We're pretty good. Cold up there in Boston today?
Yeah, it is. We had a foot of snow in the last couple of days. It's a tough winter so far, but we're hanging in there.
Yeah. Well, hey, it's good to have you here, David. We've, Ron and I were just talking. This has been a show really focused on transparency, and Ron really talks about the right to know. And you're one of the pioneers. You were way out ahead of the market. Give our audience a little background on Consumers Medical Resource.
Sure, you bet. And thanks for having me this morning. I appreciate it. We started 17 years ago. And the reason I started the company was I knew a 20-year-old girl who had a mastectomy for breast cancer and found out a year and a half later that it was overly aggressive surgery, that she would have been just as well off with a lumpectomy, a much less invasive procedure which would have saved her breast. And had she had the opportunity to do it all over again, she would have done it very differently. And it cost her mother's employer $30,000 more for this more invasive surgery. So we thought, I started doing some research, and it turned out at the time that 1 out of 4 mastectomies were unnecessary in the U.S. Per the American College of Surgeons. And the notion was not all doctors are created equal, and if we could reduce variation in care faster by giving good information in the hands of the patient, as a consumer, could we drive improvements in quality and cost efficiencies faster? So that's how we started with cancer, and today we do it on any medical condition out there.
Now, where's your data come from, David? How do you pull your data together?
It's really about best evidence research on data. So as medicine changes, there are another study that I found was when a new treatment is developed in America, by, let's say, a pioneering doctor, it takes 3 years before all doctors are aware of the treatment and 7 more years before it's implemented in practice. So as science is improving, and let's say there's a new chemotherapy agent that's more effective for curing breast cancer, we help sift through those developments in medicine, understand what's relevant to the patient populations we're serving, and present that data in an organized, clinically appropriate way, and in a way that they can understand it, so that as they're talking to their doctors, they might say, hey, I just heard about a new chemotherapy agent that is significantly more effective for this form of breast cancer. Can I have it, or why aren't we talking about that? So we're really a group of physicians, leading folks, and researchers that are trying to make sense of developments in medicine in a way that can help patients get the latest and greatest as it relates to medicine and its effectiveness.
David, this is Ron Bachman. Can you tell our audience a little bit more about what your business model is? How do people get the information? What does it cost? Who are you selling to? What's your target market?
Well, today we've, from an efficiency perspective, we've marketed it to large employers around the country. We work with some of the most progressive, largest employers in America, groups as large as 170,000 employees with one large customer we have. And they market this as a benefit and really position it as one of the most important benefits that their people have access to. So the program is confidential, it's free of charge, it's voluntary, and the idea is the customers we're serving primarily are employers that believe that if their people are more involved in decision-making, particularly around clinical decision-making, we can drive improvements in the healthcare system and lower costs much faster. We are working on a consumer initiative now where we hope in the future we can provide our services to all Americans at a modest fee on an individual basis.
Why do you think it takes so long for good medical practices to get through to be actual common practices by physicians in the marketplace?
Well, it's a great question. It's really due to biotechnology and the opportunities that are being created with it's changing so rapidly now. So it used to be in the 1970s for cancer treatment, you really had one form of treatment, which was surgery and maybe what they called interleukin-2, which was the first form of chemotherapy. What you have now today are multiple surgical options, multiple chemotherapy agents, hormonal therapy, radiation therapy, and it's very confusing for not only patients but doctors to be continually up to date on what's happening within their own practices. So the opportunities are there have never been better treatments available. The issue is it's changing so rapidly that in order for specialists to absorb that information, incorporate it into their practice, it's taking far too long for patients to get the benefit of that. So what we're trying to do is close that gap faster by allowing the patient to really understand what the latest, most effective options are and making sure that they're having those conversations with their doctors.
Do you have information that's available to patients on, say, cancer trials to get people into those areas that really aren't proven yet, but they're taking in selective patients? Can people access that kind of information as well?
Yes. I mean, we do everything, and I'll give you a great example of clinical trials. We had a woman in the last 2 years who had an advanced breast cancer, and the doctor was recommending a clinical trial because nothing else had worked, and she came to us and said, you know, what can you tell me about this clinical trial? And what she didn't know was there really was no evidence that this treatment would work, and they were in what they call a phase 1 trial. Phase 1, all it's measuring is how sick the patients get and whether, in fact, they can sustain the treatment. She thought there was more evidence that it actually had been proven in some regard to help with breast cancer. And what she told us afterwards was, you know what, I passed on that trial. I did feel I was getting some pressure from the physician to enroll in the trial. They were looking for patients to enroll in the trial, and I felt I was getting pressure. Once I had the information, I was able to make a decision that was best for me. And in this case, I decided to pass on this treatment because there really was no evidence it was going to be effective at this point. So we're not trying to make value decisions on have the trial, don't have the trial. We're trying to present the best evidence information out there so a patient can make an informed decision with their doctor.
Are you also providing information on maybe just not the physician's treatments, but on new devices that are available, new medications that are available? How do you keep up with all that? And is that part of your information?
Yes, it is. I mean, as I said, today we started with cancer. We cover every medical condition known to man. We research every specific topic based on the age of the patient, the demographic, the gender. Nobody gets turned away, and it's a lot of work. What we try to do is we set ourselves up internally to have physician-led teams that are assigned to specific disease areas, and they're responsible for making sure that the materials and information and data we're providing to patients is totally up to date, and we are overhauling and updating our information throughout the year depending on the rate of change within the disease area. So what we've developed over a long time is a highly systematic way of making sure that what we're providing people is really totally up to date. And as I've mentioned to many people in the past, it's a full-time job. We're really a clinical and research company helping to help patients understand all of this information, the options available, so they can make good decisions with their doctors. And it's a lot of work, but we've developed a system that we think is pretty good for getting it right.
Hey, David, let's go back to your employer-client and the value proposition for them. You talk about ROI, and you specifically talk about a no-risk savings guarantee. Talk a little to our audience about that, if you would, please.
Well, it's a good question. And, the problem with the healthcare industry has been many employers in particular have been highly disappointed with the lack of real financial return on many of the programs they've invested in. And we see it with our customers talking about the disappointments they've had with some of the programs that have come to the market in the last 10 years. Disease management is a great example of where more people are turning off these programs than putting them in because of lack of evidence that they actually improve quality and reduce costs. We have one of our customers, a leading Fortune 500 company, brought in actuaries to measure the cost-benefit of all their programs, including ours. And what they measured with our program was in the area of elective surgery, where many Americans are being recommended for back surgery, knee replacement, obesity surgery, and they do just as well without that surgery or a less invasive option. And these actuaries did a 2-year study on our program, and for this employer, they measured that in 62 cases, we had saved $1.7 million in the direct cost of care. So these were people being recommended for surgeries that they clearly did not need. We had the highest ROI of any program within this employer's environment. So we turned around and contacted that actuarial firm and said, would you be willing to run this type of analysis on any of our customers? So we now provide a savings guarantee that I think is highly unique, where the customer's data is shipped to the actuarial firm each year. They will measure on a claims basis, claims record basis, validate that the change in treatment happened due to our intervention, and then they calculate the savings based on the employer's actual cost of care, based on the insurance networks that they use. And if we don't cover the cost of our service, break-even point, 1-to-1 minimum, on 5 elective surgeries, we provide a dollar-for-dollar back refund to ensure that the program is effectively risk-free and the employer is not really spending anything out of pocket for the program. So I think what's unique about our savings guarantee is we're the only people that have proven within our space that the model works and saves money, and we're using independent actuaries to validate that on a year-to-year basis, and then providing this kind of no-risk guarantee. So we're excited about it, and a number of companies are using it with us today.
Well, David, we got about 30 seconds to go. Leave our audience with a takeaway, if you would, please.
Takeaway is phenomenal opportunity right now for Americans to be more actively involved in decision-making. And by that, I don't just mean a price transparency, but real active clinical decision-making. It's the largest untapped opportunity, we think, in the marketplace. And what we've been able to prove is Americans can do it. You just have to give them the right information at the right time, support them through the process, teach them how to do it. And we see a future where Americans are going to be highly effective healthcare consumers, and we're going to help them get there.
David, listen, thank you very much. Enjoy your weekend. Stay warm up there in Boston, and we'll talk to you again real soon.
Thanks, guys. You have a good weekend as well.
Yeah, take care. And to our audience, thanks for joining us today, and we'll see you next Friday on Healthcare Consumerism Radio.